Hello, my name is Dr. Emma Lim, and I'm here to talk to you about the Kids Med project, how to teach children to swallow pills safely, easily, and saving money. Pill swallowing is a skill for life. It's simple, it's fun, it improves medication adherence, helps the environment, and saves money. This is my hospital in Newcastle, and this is me and my pill swallowing champions. And I'm hoping that you'll become pill swallowing champions today. I want to teach you why we should teach children to swallow pills, how to do it, and what you can do. Because the main reason that children don't learn to swallow pills easily is because staff and parents lack the knowledge and confidence. And then they go home and they struggle to take pills. Just think about it. You would never send a child home with an inhaler without instructions. So why are we doing it every single day with pills? When you are in your local pharmacies, do you ask parents if they have problems? Parents can struggle to get their children to swallow pills. And actually, we know that it's something that we can help them with. Syrups taste bad. They're bad for kids' teeth. They have short expiry dates. They're hard to get hold of. They need to be stored in a fridge, and it's difficult to travel with bulky medication. It's not just parents that find syrups hard, it's staff as well. Liquid preparations are unlicensed. Accurate dosing is tricky. Liquids come in different strengths, so there are safety issues, and they're really expensive. Quite how expensive can surprise you. My next slide shows a table of suspensions versus tablets. So this is the equivalent amount. Nitrofurantoin, a very common antibiotic, costs 150 times more as a suspension, and prednisolone soluble tablets compared to ordinary tablets are 30 times more expensive. This is a project we did with renal patients. Over 3 months, we converted 21 children. The youngest was 5 years, and we switched 36 medicines from syrups to tablets. We saved £42,000 a year in recurring costs. And it's really important to think what impact that would make on children with long-term conditions. So the classic condition is HIV. Often the syrups are really disgusting, and some formulations only exist as tablets, and these are the real life size of tablets. So this is a skill that children with TB and HIV really need. And it's not just about the financial cost, it's also about the cost to the environment. Liquids are more bulky, so there are greater transport and packaging costs. There's more wastage because you have to dispense full bottles. We actually won an award for this work in 2020. So I want you to think about asking parents a question. Do you know how to get your child to swallow a pill easily? Because that's the first question we must ask. Often parents are forcing their children to take pills or just leaving the pills on the side and not using them. When you're thinking about what techniques we use, remember children learn best with play and relaxation. We need to think about their head position. Don't throw the head back. That shuts off the esophagus. They need a neutral head position, and you can use pill cups or pop-top bottles, which I'll explain about later. First of all, when you're doing any training, think about the right time and the right place. This is only going to take you 20 minutes, and staff or parents can do this training, but it needs to be somewhere quiet with no distractions. And children need to have some choice over this. It's really important to give them the choice of what to drink. You can practice swallowing pills with water, with milk, with sugar-free juice, but actually thickened liquids like yogurts work really well as well. And I'm going to explain to you the pop-top bottle technique. So you need a bottle that looks like this. And the child will need to make a good seal around the top of the bottle. They need to take 3 gulps without putting the bottle down. So gulp, gulp, gulp. And that action will just pull the pill down. It's really easy. And you can use recyclable sports cap bottles for this. So we would give parents an information leaflet, and we would explain to them choose a place, choose a drink. Practice with some sweets of different sizes, starting at little tiny ones. Put the sweet in the middle of their tongue, take the bottle, 3 gulps, and it's gone. Just keep practicing with different sizes. And this is really important because I'm asking you to think about how you would do this where you work. This is us training our staff. Now, we train doctors, nurses, pharmacist technicians, place specialists, students, everybody to do this. That was our renal team practicing. And I have some top tips for you. When you're doing it with children, never say try with a bigger pill. Always say try with the next sweet or the next tablet. If they fail, go down a step and try their last success and stop there. You may have to come back to it. And remember, constant praise. You don't need to have many things to do this training. So all you need is a few sweets, and here's some that we had, and some dummy capsules, a bottle, and the knowledge, so you can print off a leaflet or give them a link to our online work. And that's all they need. If we're doing it in a hospital setting, we just have a little box here with some pop-top bottles and sweets. And this is our illustration kit with the real tablets that they would need to be able to swallow for them to practice with. And you could have this anywhere, at a pharmacy or in a healthcare aid post. So I want to tell you one thing. I think that pill swallowing is a simple skill for life. It's adaptable. You can do this anywhere. You don't need many resources. It has a huge impact because you can save money, improve medication adherence, and make families happy because actually it's fun and nice. This is all the resources we already have. We have an e-learning module that is free, open access. We've got our publications here for you to click onto, and we also have open access podcasts where you can listen to stories of our pharmacists and children talking about their experiences. And we have a video on YouTube to show you exactly how we do it. So one of our nurses, Elsa, is teaching a child on it. It only leads me to say thank you to all my colleagues at the Great North Children's Hospital in Newcastle, Nicola, Elsa, Vincent and Lisa. Thank you to Alice and Liverpool John Moores University, who I work closely with, the Academic Health Science Network for their funding, and support from the Royal College of Paediatrics and Child Health. I'm going to leave some time for questions, and I think that this is going to be over conversations with coffee, so I look forward to seeing you all there, where you can come and ask me the nitty-gritty of how to teach pill swallowing. And we're also running a workshop for pill swallowing this afternoon, so for those of you that have signed up, I really look forward to seeing you later. So it's goodbye from me here in Newcastle in the United Kingdom.